Good morning again, everyone. Thank you so much for being here with us. My name is Dorottya Ercsei, and I work at Terdizom. I'll be your facilitator today. This webinar is hosted by the Child Protection Hub. This is an interactive platform for professionals working with children. Child Hub is maintained and hosted by Terdizom, and it serves as a space where professionals like yourself can exchange experiences, knowledge, learn from each other, and offer and receive support. We believe that by sharing expertise, we can strengthen child protection efforts across Europe and beyond. As part of this mission, we are proud to host the Psychological First Aid for Children e-learning developed by IFRC and the Geneva Learning Foundation. And it is now available in Ukrainian, Romanian, Polish, and English. And we are really excited to announce that we are planning to expand its availability by translating it into additional languages in the near future. So today's webinar is part of our commitment to ensuring that professionals working with displaced children have access to the tools and knowledge they need to provide effective psychological support. I'd like to inform you that this webinar is being recorded, but your names won't be visible on the recording, only the speakers and myself. So what can you expect today? During this 90-minute webinar, we will explore how psychological first aid can make real impact for children affected by displacement. We are honored to have a panel of leading experts in mental health, psychological support, and humanitarian response with us today. First, you will hear from Amanda Amig, who is an IFRC project officer supporting the implementation of the EU4Health Project across Europe. Then we will have Gracie Trejo, health and emergency response expert with more than 16 years of experience in MHPSS and public health. Then Humani, an MHPSS technical team lead at the Ukrainian Red Cross, who brings expertise in crisis support. Nikolina Stankovic, psychologist at the Croatian Red Cross, specializing in mental health support and training. And last, we'll have Reda Satki, Executive Director of the Geneva Learning Foundation. We'll have a Q&A session at the end of the webinar, so where you can ask your questions directly to your speakers. So please feel free to drop questions in the Q&A box at any time, and we can address them during the discussion and, at the end of the webinar. So thank you very much for being with us here today. We are very happy having you, and let's get started. I will hand it over to Amanda Amig, who will give us an overview on the EU4Health project. Floor is yours, Amanda. Let me just share the PPT.
Thank you very much, and good morning to everyone. Warm welcome. So glad to see so many of you. So my name is Amanda Amig. I'm project officer at the IFRC Regional Office for Europe. And I will start by just giving a brief introduction to the EU4Health initiative, which focuses on providing timely and high-quality psychological first aid to people affected by the humanitarian crisis in Ukraine. The international armed conflict in Ukraine has forced millions of people to flee both within the country and beyond. And the hardship of violence, displacement, family separation, and other life-threatening events have severe and lasting effects on mental health, or can have. In response, the Ukrainian Red Cross Society and national Red Cross societies across Europe have been on the forefront of providing essential humanitarian aid, along with critical mental health and psychosocial support to those affected by the crisis. So we can move to the next slide. So the EU4Health project was launched through a unique partnership between the Directorate General for Health and Food Safety of the European Commission, DG Sante, and the International Federation of Red Cross Red Crescent under the EU4Health program. It brings together 28 Red Cross national societies, with the technical support from the Red Cross Red Crescent movement, MHPSS Hub. And this is the largest mental health initiative in the history of the Red Cross Red Crescent movement that is dedicated to supporting the psychological recovery and emotional well-being of individuals impacted by the armed conflict between Ukraine and Russia. So as you can see, the project is structured around 3 key objectives. The first one is about providing psychological first aid, or PFA, and mental health psychosocial services, MHPSS, within Ukraine and in host countries. The second one focuses on supporting staff, frontline responders, and volunteers, addressing their mental health and psychosocial needs and strengthening their capacities to deliver effective support before, during, and after crisis. The third objective is about enhancing coordination and collaboration, strengthening partnerships and cooperation among key stakeholders involved in MHPSS interventions. I will go a little bit more in details about key activities under these objectives. So next slide, please.
I'm sorry.
No problem. Yes, this is just to highlight the scope of this project that initially started with 6 national societies in August 2022 with Ukraine, Hungary, Poland, Slovakia, Romania, and Czech Republic. And from January 2023, it expanded to 22 other countries across Europe, ensuring that displaced people from Ukraine receive the mental health and psychosocial support they need. So we are one big family. Next slide, please.
Sorry, Amanda.
No problem. Okay, thank you. So this is just to briefly go over some of the key activities per objective, just to give you a sense of what is implemented on the ground with this project. The first objective, which aims to ensure delivery of quality mental health and psychosocial support, focuses on capacity building of Red Cross staff, volunteers, Ukrainian health workers, and frontline responders in psychological first aid and broader mental health and psychosocial support. It is essential to ensure that they have the necessary skills, knowledge to provide immediate support to affected population. Additionally, the project aims to train teachers' assistants, social workers, and health professionals in PFA, psychological first aid for children, which we will explore in more details with the next speakers. And the last point under this objective, which represents really the essence of this project, is the provision of first-line mental health and psychosocial support through helpline and other service platforms. And this entails sometimes one-to-one sessions, community-based psychosocial and well-being activities, helplines, chatbots, etc. The second objective focuses on the well-being of staff, volunteers, and frontline responders. And this is really about strengthening internal support systems to ensure that responders have the necessary resources to manage their own mental health while providing services to others. And this includes training team leaders, enhance organizational resilience, and leadership in psychosocial support. And this is essential to support the people providing the services in the form of supervision, counseling, and peer support mechanism, among other initiatives. The third objective is about enhancing collaboration between Red Cross national societies and key stakeholders within their context, which includes a humanitarian organization and local authorities. And to improve, essentially to improve the coordination of MHPSS activities, facilitate knowledge sharing and cooperation among actors to better ensure an effective and sustainable response. We can go to the next slide.
apologize for these technical issues with changing the slides.
No worries. So the next slide, yes, thank you. I'd like to zoom in on the key component of this project and today's main topic, which is psychological first aid for children, strengthening capacities to support children in crisis and displacement. This extension of activities within the project was launched in October 2023 to enhance the capacities of professionals such as teachers, social workers, health workers to better support the well-being and resilience of children, both within and outside Ukraine in host countries. Children account for about 1/3 of those granted temporary protection in the EU, and the loss of loved one, disruption of family structures, prolonged displacement, extended school closures, and lack of in-person learning are all significantly contributing to increased mental health challenges among Ukrainian displaced children and youth. So with this initiative, we aim to provide training in PFA for children so that professionals are better equipped to identify children's needs, offer appropriate support, and make referrals when needed. And this is done through a comprehensive training approach. We have 12 Red Cross national societies that are listed here who are implementing in-person trainings for these professionals within their countries and context. And this is complemented by remote learning solutions developed in partnerships with Terre des Hommes, Child Protection Hub, and the Geneva Learning Foundation. And that includes self-paced e-learning, interactive peer program, that are available in different languages, and we will also hear more about this later on. Next slide, Dorka, please. So thank you, that's it for me. Thank you for your attention, and I will hand over to my dear colleague who will walk you through the methodology of psychological first aid and its crucial role in supporting children's well-being. Thank you very much. I will add in the chat also a page for information if you want to have more details about the project.
So thank you for this insightful overview, Amanda. So now I'd like to invite Gracie Trejo to take the floor.
Thank you, Dorothy, and thank you, Amanda. My name is Gracie Trejo. You already know me in the social media was explaining what I'm doing, but for those that joined recently, I'm working with the IFRC in the regional office that we have in Budapest. I work daily with Amanda, and I'm responsible for all the mental health and psychosocial support folder that we are implementing in the 53 countries in Central Asia and Europe. And today I have the pleasure to be with all of you, and I am really excited that it's 201 people connected here, and this for me represents that you really are interested in the well-being and mental health of our children and contribute to transform our society to be more human, and this approach and these trainings be implemented across, for example, all the school programs. And this is really important, especially to support the well-being and mental health of children and adolescents affected for conflicts or any kind of crisis. So I'm gonna try to navigate shortly because I have just 10 minutes, and I appreciate that my colleagues let me know when is my time to navigate. But my principal two objectives today is that if you don't complete the training yet, you fall in love and say immediately when you finish this webinar, I need to take the training. And the second is that you establish a relationship with your Red Cross or Red Crescent in your country if you want to learn more and see how to support our children and teenagers in such kind of situations, okay? So let's start, and let me go here in my presentation. We are going to speak briefly about this introduction, what is PFA for children, some key highlights in the approach and methodology, and relevance for all the professionals that are working especially with children displaced, okay, for a disaster or for a conflict. Also, I want to say that everything that I'm going to share with all of you is based in 16 years of experience and having presence and participation as a health personnel in public health and mental health in different emergency crises, from Mozambique, Pakistan, people displaced from Syria, and it's based in evidence what I'm gonna say to you and how effective is this approach. And it's true, like Amanda mentioned, that EU4Health is giving the opportunity to provide PFA for many people, but the Red Cross, Red Crescent is doing this for many years because it's one of the compromises for us to improve the well-being and mental health of our communities, and especially the most vulnerable, okay? Saying that, let's navigate here. One thing that I want to say is that PFA is part of the tools that we have in a component in health that we denominate mental health and psychosocial support, okay? So I want that you keep in mind that it's a tool. We have several to improve the well-being. We have child-friendly spaces. We have parenting, schools, and many other community also tools, okay? So this is one of all of them that help us in different levels to support people. And here you can see a short definition, okay? Psychological first aid for children, it's an evidence-based, this is important, it's for many years tested and proved, and we know that it's effective. It's a human and practical approach to supporting the children in distress. I hope that all of us, we know that distress is when you are anxious, when you are sad, it's many expressions of emotions when you are having uncertainty in front of a specific situation, okay? And what does the PFA do? Okay, it is gonna be briefly because you need to pass the training. And I would like that you write in the chat box if you pass already a PFA training, okay? You can write yes, and I can count more or less how many of you already passed the training, okay? So the PFA help us for the children feel safe and support, especially because each event, disaster, and conflict is really distressing, okay? Provide immediate emotional support, especially to stabilize their well-being. And also this encourages a base age healthy coping mechanism. This is really important. This training helps all of the professionals to really address the need based in the age of the kid or the teenager, because it's different. And it's gonna help connect the children if they need it with another resources. So as you can see, have 4 key components that you can do when you learn PFA. Here I want to take your attention. It's true, for matters of time, I can navigate in all of them because we can pass hours speaking about all of these things. But what I want to say that why it's important when we have children or teenagers facing such situation, exposed to disaster and crisis. Take just 30 seconds and imagine when you was having 7 years old, for example, how you see the world, okay? And how stressful can be for you any change, okay? It's in the normal life, some change like a divorce or an accident or something like this is impactful. Imagine when it's a matter of a conflict. Statistics say clearly how this affects the well-being and mental health of adults and children if they don't receive on time the proper support. And PFA is the first thing that we need to provide. So it's important because children experience the crisis different from adults, okay? And there you can see that it's a brain. And this is true because why? Because they are in this development process. It's many neurological connections, cognitive and emotional learning that is at some point they face a disruption there, and we don't intervene on time with the right skills. This can create a distortion in their development and create complications. And this is a preventive tool. Just they needed our support because they are learning and they rely on us as adults in guide them in this process. Another attention here is that for the professionals working with the children, remember that it's a cultural aspect between all of these that is also influencing how the children experience a crisis related with the culture, because unfortunately, stigma prevalence across different cultures, and this influence that parents and the kids are not having emotional literacy, and they don't know how to recognize what is happening with them, okay? So when you learn PFA as a professional, you are supporting also in the fight against stigma, and also promote a culture of well-being and increase the literacy in emotional intelligence as well, okay? Also, they need early support, as I say, to reduce this long risk of impacts, okay? With this training, you can support to avoid any mental health condition that can be developed by the kid or the teenager. PFA also help the children to keep again a kind of normalcy, okay? Because this is important for kids to feel a normality despite all the situation, okay? This makes them to feel really safe. And it's a flexible and adaptable tool that everyone can use in different settings with the proper training skills, can be applied to different cultures. I can say this, as I told you, we apply in several countries and it's effective, and you can adapt to the culture of the people that you are serving, okay? Some highlights here. Okay, let me see how I'm going. Oh, time is passing. I think you're gonna receive these presentations, or it's gonna be uploaded somewhere, but it's having a practical and immediate support approach. As you can see, we pretend that children feel safe, we can stabilize their emotions, and as I say again, teachers can provide these, social workers, health providers, because you know something, being part of the health sector, many people think that as teachers, as nurses, doctors, we know everything about how to handle emotional situation, and it's not 100% true. And we need to pass also these trainings to have better skills and approach on the best way what our kids are facing, okay? More thing that is important, I say before, is adaptable to all the cultures. I'm not gonna stop too much here. About the methodology, it's really simple and it's lovely how it's created. You can join the LLL team, that is look, listen, and link. You are gonna learn how to look what is happening in the kid or in the teenager, some specific things that can be different from the normal behavior that we expect depending on their age. You are gonna also listen. You are gonna learn how to really listen on the way of a kid with 6 years old, 8 years old, also adapted to the new situation that we have, because teenagers are having a different language, different behaviors, that this listening, it's there in the training. And we are gonna learn also how to link them with the right resources, support, to avoid what I say before, any kind of suffering by the time that is gonna influence their life, okay? Important is a no-intrusive children-centered approach. I don't know if I'm having some issues with the sound. I hope you are hearing well. Important is not forced conversation. You're gonna learn to give them their time. Second, empower them for self-regulation. This is important here, and again, we need to promote emotional literacy and invite all the teachers, all the health workers, social workers to navigate more on this and try in our settings to implement as well activities that help our kids to recognize more what is emotion, that is not bad or good emotions. This is important to do this exercise in our school curriculums, okay? And again, promote long-term recovery. I think I'm running out of time, but if you allow me to have 2 minutes more, we can navigate. And here I have just 5 of them. Remember that you are gonna learn, it's important for you because you are gonna recognize children reactions on time, okay? Second, you are going to provide immediate psychological support, comfort, stabilization, and help the children to reassure that he's safe. It's really important, and this training is going to help you to do that. And in this third tip, it's important that this training, it's age appropriated, okay? And you're going to learn also communication techniques to address their emotional needs. And there you will see My Hero is You. I invite all of you to keep in mind. We are going to share the link later. Also, you need to see how to address, for example, by song, by playing, applying the PFA to observe what is happening with the kids. We need to speak in the language of them in order to keep and hear what is happening with them and link with the right resources, okay? Sorry, we are almost there. Important, enhancing protection and referral pathway. This is important for you as a professional to keep in mind clear referral pathways, to know how to address the situations that you are going to discover when you are looking and hearing the kids, okay? We need to be prepared and have a referral system, because it's our mandate to guarantee that anything that we detect, it's in the right hands. And the final is promoting resilience and social inclusion. With PFA, we need to support the kids that are displaced right now for the situation in Europe or in another country to feel safe, feel normal, and be integrated better, okay? This is a lovely tool, a training that you need to pass. And this is what I can say in a short sentence. PFA is a tool that helps all professionals to support children to really achieve mental health. And mental health in kids is to feel safe, loved, supported. Okay, and this is based in the WHO definition of mental health. So it's in your hands to support them, do the training, be in contact with your Red Cross in your country or Red Crescent. Here is more resources that I invite you later that you can also pass these trainings. Contact Red Cross for that and Red Crescent. And just this to close my presentation. I'm sorry for being so fast, but I hope you are gonna go and pass the training. Over to you, Dorothy.
Thank you so much, Gracie, for these valuable insights. And just a quick reminder that while we are getting ready for our next speaker, that you can drop your questions in the Q&A sections and we will address them at the end. Thank you. So Dennis Humani, the floor is yours. Let me just share your PPT real fast.
Oh, hi, dear colleagues. My name is Dan Humani, and I'm MHPSS technical team lead in Ukrainian Red Cross HQ. And I'm very happy to be here with this amazing and so big community of practice. And now I wanna share a Ukrainian Red Cross experience with the following. The needs of children in Ukraine and the critical role of supporting for caregivers and professionals working with children. Next slide, please.
I'm sorry, it seems like
No, it's not a problem.
I have this on my computer.
Yeah. Let's start. The key topics of this short presentation: addressing the needs of children in Ukraine, initiatives of URCS to build the capacity of professionals working with children and psychosocial support for children, and the critical role of support for caregivers. Next slide, please. It's important to understand that the needs of children in Ukraine have been changed since the beginning of the escalation of the armed conflict and up to now. It's important to emphasize that in 2024, children's well-being was significantly affected by a large numbers of war-related stressors, and children experienced emotional and behavioral problems as a result. But in 2024, the military context has not disappeared, but the case of stress or distress of children is the following. Parents worry about their children, and children are affected by their parents' stress. Thus, if we reduce the stress level of parents, we help children. Let's keep in mind this idea and come back it later. Next slide, please. So, what are the key signs of distress of children in Ukraine today? Among them, difficulties with socializations, difficulties with communication with others, and difficulties in building relationships with other children, and it was the most common problem observed among children across the city. The second, sense of anxiety, were the second common observation by the parents, staff, and volunteers. And some children are showing an increases in aggressive behavior, which in some regions has manifested itself in fighting with other children, yelling, and sometimes beating and scratching. Next slide, please. Yes, thank you. The most common cases of distress in children now include parents' distress was named by all groups of survey participants as the most common case of children distress. Volunteers and staff noted many children who expressed concern for their parents' well-being and a desire to care to their parents. Ongoing shelling and conflict-related threats were the second most common case of distress, observed through physical signs of fear and distress after shelling, sirens, or reminder of the conflict. Isolation and loneliness were also frequently cited as a case of children's distress, caused by prolonged period of being alone during the COVID, which was acceptably by the conflict. This include a lack of friends and time to spend with children their own age. So, there are many cases of distress of children. And what does the Ukrainian Red Cross do to meet these needs at the best way? Next slide, please. Do you remember when we keep in mind the idea that when we reduce the stress level of parents, we help children? In Ukrainian Red Cross, we tries to work systematically, comprehensively, keeping in mind the critical role of supporting parents and caregivers, and building the capacity of professionals working with children, as well as directly providing psychosocial support for children. The Ukrainian Red Cross Society provides mental health and psychosocial support services to the population of Ukraine, both by providing services to communities and by building the capacity of service providers. URCS specialized in providing first aid trainings, including PFA for children, of course, community-based psychosocial services for children and families, and non-specialized mental health services for those who need them the most, including counseling, psychoeducation, and referrals to psychological support services within URCS or externally, of course. I would like to share a short case study on why it is so important to work in a comprehensive manner, delivering MHPSS services directly to children at the same time conducting psychoeducation, awareness-raising sessions, and trainings. And I remind you again about PFA for children, no, for adults. Okay, in 2022, we worked as field specialists during the evacuation. And in one of the temporary points, temporary accommodation centers, we systematically support children. And it is so happened that after our basic activities, where we reduce children's stress level, raise their stress resilience, the children returns to the parents. Not all parents, but some of them would yell their children and beat their children. And this greatly negated our work. And what could we do about it? What could we do with this? We went to talk to the parents with great respect and tried to do no harm. And it turned out that the parents simply didn't know any other way. It was the, cultural tradition to beat, which had been passed down to them from their parents. So what did we do next? We simply held awareness sessions for parents. We conducted psychoeducation for parents. We taught them how to reduce their own stress level and how to raise their children in different way without beating them. And we received a lot of gratitude from parents. Parents also began to join family events and became volunteers. Did we conduct PFA for children training for those parents at that time? We didn't have that capacity back then. But now in 2025, we would differently do it. We would provide PFA for children training for parents. Next slide, please. We have, key findings. Okay, given that
I'm sorry.
no, it's not a problem. It's not a problem. Given that we are running out of time, I would like to share a few of our key findings to summarize this short presentation. Okay, the first, needs changes. Conduct regular needs assessment and incorporate the results of those assessments into the adaptation of MHPSS activities. The second, work systematically and comprehensive integratively, deliver community-based services to children and families, and at the same time provide PFA trainings for adults and psychoeducation if time and resources are limited. Supporting the third, supporting caregivers. This is a critical to children's well-being. It's also critical to provide training for first responders or helpers, basic PFA, and for professionals working with children, PFA for children. And at the end, take care of yourself and share your experience. And thank you for your attention and have a nice day. Stay in touch. Thank you.
Thank you so much, Dan. Thank you. So I would like to give the floor to our next speaker, Nikolina Stankovic, who is a psychologist at the Croatian Red Cross.
Thank you so much, Dorothy. Hello, everybody. I would like to say hello in behalf of the Croatian Red Cross. I'm really happy for having the opportunity to share an example what we did back in Croatia. So following what Dan said about how important it is to support parents, based on this idea, we actually went also a step in this direction, supporting the significant adults in children's lives. And this is why we decided to go to schools and kindergartens, as schools and kindergartens are a setting that is very important for all children, and not just academically, but also for their psychosocial well-being. And this is where we are really grateful to the project that gave us the opportunity to actually put our plan into motion and to offer a new training that is the PFA for children for schools and kindergartens. And I would also like to thank our colleagues from the Youth and Volunteers Department, but also the Education and Teacher Training Agency. So the Education and Teacher Training Agency is a very important actor when it comes to educating teachers, kindergarten and school professionals. And the Croatian Red Cross has a long-standing collaboration. So it was a great opportunity for us to put the PFA for children as a new topic in an already existing programs for schools and kindergartens. Based on our experience, as the Red Cross has also a long experience in supporting people with migrational background, asylum seekers, people who were granted some kind of international protection, also people displaced from Ukraine, but many others. So we used the opportunity that besides the materials kindly presented by Gracie earlier that are PFA for children, we added also the component that is focusing on how to support children with migrational background. One important, why that was very important for us is, as Croatia is traditionally more emigration country than an immigration country. And as a nation, we were being the ones traveling more to other countries because also the reasons related to the homeland war, but also for some economical reasons. So for Croatia, it is actually quite new to have children in kindergartens and schools that have some migrational background, including refugee children. So what we managed to do, thanks to the project, is to prepare and deliver a one-day training that is in Croatian. So it's a face-to-face or an online, but all the information about the trainings are available on the training application portal of the Teacher Training Agency. So just a bit about the statistics so far. So since the PFA for children training started in the schools and kindergartens, we trained in last year more than 1,000 teachers and kindergarten staff. And the good news is that we also began the training this year, and it will be continued. Based on the feedback from our participants that went to our face-to-face or online trainings, they really appreciated the practical knowledge, and they see the PFA principles as they are trained from the IFRC as very easy to remember and well structured, and they see it really as something that is very applicable to their work. It was also very well appreciated that the theory that is in the background is something that they can really connect to their practice, and that's during the trainings that they also have the opportunity for sharing real-life examples, but also that the sessions are very interactive and interesting to them, because we are trying to engage through quizzes or to role-playing or some other methods that were also proven to be effective in teaching adult people. It was also a great opportunity for a lot of participants to for having the opportunity to hear others share their own experiences, and also to connect those experiences now maybe with some previous experiences that they had during the Homeland War, or if some of them were displaced people themselves in the past. What was also very well appreciated were useful links and materials regarding some information on integrating refugee children, but also a platform that is available on our webpage. It's the Saver Schools and Kindergartens platform that I will tell you more about in a second. What is also great news for all those participants from Croatia listening is that we are continuing to have the face-to-face trainings. We have already a plan for the 2025. We managed to integrate those topics with topics that are very relevant to the participants as well. So we offered the psychological first aid trainings together with our health programs, with the migration programs, and with disaster preparedness programs. And another information that I'm really excited to share is that we are about to finish our guidelines on PFA for schools and kindergartens that will be available in Croatian, but also in English. So this is something that is also coming soon. So just a few practical information on the official website of the Croatian Red Cross. You can access different publications that are in Croatian, but you can also access the Saver Schools and Kindergartens with all the instruction how the schools can apply for it and what are the benefits for the schools and for the teachers. Also, if there is any other information you would like to hear more about our trainings or about the projects, or reach out to the Red Cross, here are our contacts. So I'll be happy to respond to all the questions. Thank you very much.
Thank you very much, Nikolina. Then I will invite our last speaker, Reda Satki, Executive Director of the Geneva Learning Foundation. The floor is yours, Reda.
So I'm going to share my screen, but using my webcam. So I hope that will be just, yeah. Okay, and if I could ask you, Dorothea, to spotlight that webcam so that will make it.
Yes.
Okay, wonderful. Yeah. All right, so thank you very much for the invitation. We really appreciate and support the Child Hub's mission and the work that you do. So as Dorothea said, I'm Reda Satki. I lead the Geneva Learning Foundation. We came to PFA for Children in collaboration with the IFRC, and of course, this is part of the EU4Health program. So to go back, Yusa, our focus has been on creating and really co-creating peer learning opportunities with education, social work, and health professionals from Ukraine and from all over Europe. But then we have to take a step back. What exactly is peer learning? So human beings always learn by experience, primarily learn by experience, and that learning, that experiential learning, tends to involve sharing experience with other humans. Now, what has changed with digital networks, with digital platforms, is that in the past, you were constrained to the experiences of those around you in your immediate environment. It was much more difficult to connect with others, and it's now, in principle, very easy, but the key is the connections and the quality of the connections that we're able to make. So peer learning really complements technical training, which is the main mode of learning with respect to PFA and PFA for children. And on the left-hand side, you can see some of the benefits and really key strengths of technical training. On the right-hand side, you can see how peer learning complements that technical training. So for example, with technical training, you get standardized content, the best available knowledge that experts have put together. Peer learning helps you take that standardized content and figure out what it actually means for you, using the experiences, what others have actually done, and then sharing your own experience. Expert-led instruction with technical training is complemented by the collective intelligence when you get a group of peers who may have more or less experience, more or less expertise, and you problem solve together. You put all that brain power together and really work together. So it's also about collaboration. So you can see the others, general principles with training, specific applications with peer learning, knowledge acquisition, and then you have knowledge creation through peer learning, individual learning, then complemented by community development. That fixed curriculum. And then you can have emergent learning when there's something new on which there is no guidance, there is no standard yet. Nobody has done this before, so it's new, as this very often happens in emergencies of any kind. And then that developing of strengthening of skills. And all of these are really important on the left-hand side. And very often we find that by adding the peer learning, we then are able to progress in terms of competency development, in terms of the actual power of a learning system to make a difference. And what this means for individual participants, you can see just 4 examples here: deeper understanding, hearing from practitioners, making new connections, and also really important, that feeling that you're no longer alone and that there are many people out there who can help you. So those shared values, those shared principles, that shared commitment in this community around PFA for children, we defined with the alumni of the peer learning exercises. I'll tell you more about those later. 4 principles that really guide us in how we develop this community. What peer learning can do relies on trust. And this is a key piece of feedback from one of our alumni. Says there is a lot of trust in our network. And that is really, really critical to any kind of network learning, peer learning as well. So really characterized by that real world focus, knowledge exchange, accessibility. Everything is open to any professional that wants to join, no matter who they are or where they are, continuous learning, and then measurable impact. So to get a little bit more specific about what the program actually, what we actually offer, the top left, you see the PFA basics, and that's a self-guided e-learning course. That's about an hour. Some people spend a lot more. Some people others spend a lot less. And that's available on the Child Hub platform as well as on the TGLF platform. So there are many different places where you can get this PFA basics. PFA Connect is actually a platform for professionals. We meet every other Wednesday, and it's really 30 to 45 minutes. Spend that focused on specific topics and then take away something that you can use in your practice. PFA Insights, I'll be telling you more about that as well. Reports and self-guided courses with certification. In fact, certification is offered across the different components of here, and what the difference is how many hours of certification, depending on, of course, the level of effort involved. And then bottom left is a peer learning exercise. So benefits for individuals include really this opportunity to discuss real world situations, exchange practical solutions, share what works as well as what doesn't, and then build your professional network. So one person said, I gain deeper understanding of children's reactions. Such a program strengthens rapid response skills. So that's for individuals, but we know that in learning and education, what matters is what happens at the level of organizations. And so this set of activities has already connected 331 organizations. You can see the split: 33% mental health, 21% other health, but 27% education and 20% social work, representing almost 10,000 staff and volunteers. This was actually a few weeks ago, and reaching these staff and volunteers together are reaching over 1 million children. So that web of connections between the professionals from these organizations participating really it has the potential to make a big difference. In fact, to recognize the exceptional commitment and leadership across this network, just a week ago, we selected and announced 75 PFA focal points coming from many different types of organizations, and you can see most of the focal points. So professionals affiliated with an organization that have made a commitment to really take this program to their organization, includes both Red Cross national societies, but also many non-governmental, governmental, and independent practitioners and private service providers. So one last quote, and I think this one is sort of outside the box. And this person said, "I understood that if we want to cry, we can cry and we don't need to appear strong every time." So that's a description overall. I want to now deep dive into the insights from peer learning to try to explain, to give a few examples really of what we can learn through peer learning and what we cannot learn. And I'm just going to share a few links here, and wonderful to see the links to the e-learning that is being shared by Child Hub, and really recommend and encourage you to go and take that, especially if you're new to PFA for Children. So in September, we shared the first insights report, and that one was about what we learned from applicants to the peer learning exercises. And I invite you to go look at that. I've shared the link to get those insights. And that first report was about the experiences of children, caregivers, and helpers. It was based on the perspectives, insights, experiences, real-world activities carried out by 873 practitioners in Ukraine and across Europe. So I encourage you to go see that. The second insights report, which we're sharing for the first time today, is actually focused on analyzing what the case studies developed by education, social work, and health practitioners across Europe. So you may ask, well, how is developing a case study actually helping me to learn? So typically we think that learning, you need an expert to present to you, and then you take that knowledge, maybe you have skills or other practical activities, and then you figure out how to take that back to the real world and apply it. So you can see here 5 reasons on the left why developing a case study is actually a really powerful learning process, especially it incorporates giving and receiving feedback, as you can see on the right-hand side. So this new insights report is focused on children in crisis and communities of care, and I'm going to tell you more about that in the time that remains. How you get these insights report is by going to the address I've shared in the chat, so that's learning.foundation/Ukraine-insights, and of course it is available in both English and Ukrainian. One last point about the sort of presentation of the report itself is that as part of the process of developing it, not only did we ask established, recognized experts of PFA for Children and of the Ukrainian context specifically to give their feedback and review the draft report, we also invited the community of participants, of alumni. We believe that strengthens the insights, and I want here to acknowledge to show you the names of the individuals who contributed to this community review. So what can we learn from from these case studies, and also what are the limitations? So this is an example. Serhiy Fedorov encountered a frightened 5-year-old girl in a shelter after a rocket strike. The girl was crying and trembling, and he did different things, focused on the teddy bear she was holding, suggested games, helped the girl shift from her own fear to caring for the bear. And the girl calmed down and later engaged in drawing activities. So we have to be cautious here with case study knowledge and with peer knowledge more generally. We can say using a child's toy as a communication tool helped in this specific situation. We cannot conclude that this is going to work with other children, or even if they are in similar situations. And you can see some of the other caveats on the slide. So good practice requires flexibility, not rigid formulas. So let's then look at what we can learn by reviewing across the case studies. And this is what you'll find in the Insights report. And it's really an invitation to think together. This is not a guidance or prescription for what you should or shouldn't do. It is actually an invitation to think critically about these experiences, reflect on them, and then reflect on if and how they can apply and can be useful to your own practice. So 3 context-specific highlights. First of all, PFA extends far beyond emergency situations into everyday environments. Again, this is what we learned by looking across the case studies and trying to see what are the patterns, where PFA was useful. Second, children often invent their own therapeutic activities when given space. And then 3, supporting caregivers significantly enhances outcomes for children. Now, 5 observed short-term impacts of PFA come out of these, emerge from these case studies. And these were not things we could predict. They're likely to be consistent with the expert guidance, which is reassuring about the relevance and usefulness of expert guidance. But we have observable changes, brief interventions with big impact, that power of acknowledgement, of validation of feelings, that physical comfort effect, and then play versus talk. We also have around family dynamics, for example, and there's many more examples from these cases that you can look at within the reports themselves. I'm only going to cover a few. So the unintentional impact of increasing a child's distress because of the parent's anxiety or change family roles. And then again, the impact of providing basic parenting guidance that often had a significant impact. One quote, this is from Elena Andras, before leaving, the mother thanked me and told me that since she was so busy comforting and creating a safe environment for him and concerned about the crisis, it never crossed her mind to just play a game with her kid. So again, using these case studies, we invite you to go download and get the Insights report. Use them to draw inspiration, complement that with evidence, exercise caution, and really adapt thoughtfully. So from these examples and from what we learned, there can be 5 key takeaways. One is PFA principles apply beyond emergency settings. Simple approaches often have the most significant impact. Number 3, supporting caregivers is essential for supporting children. Number 4, creative adaptations of standard techniques are necessary for different children. And number 5, the most effective interventions honor children's legacy, agency, and choices. So now, if you find these useful, relevant, then the question is, how can you benefit? How can you connect and plug into these activities? These are the 4 activities, and there are more that we're rolling out this week. I'm going to start with PFA Connect. So PFA Connect is every other Wednesday. You join for a 45-minute session, let's say, and for 30 minutes, you go into small group discussion around specific topics. So I'll show you a list of the topics. I think on the bottom has the English and Ukrainian mixed up, but you can see that we've discussed already just across 3 sessions, a range of topics. And so there's an immediate benefit for everyone who joins PFA Connect, of course, but there's also a benefit that goes beyond, because from each PFA Connect, we then compile a set of what we call key learning points. And this is not expert guidance. This is peer guidance, which means this is what a group of colleagues coming together to discuss one of these 4 specific topics actually came up with as sort of pointers, tips, grounded in what they've actually done, which is really the key to their value. So that's PFA Connect, and I've shared the links in the chat for anyone who'd like to join. Now, this is for professionals in the project countries who are supporting Ukrainian children. Now, the launch of the Go platform, as we developed these resources, we realized that we needed ways to share them and to help practitioners, support practitioners to do better, be more efficient, and save them time on how to acquire these different, this new peer knowledge that comes out of these activities. So we now have really an entire curriculum that offers many different opportunities. Some are self-guided, some you interact with groups like PFA Connect over a short period, and others like the peer learning exercise. That's our most intensive program, and it is 20 hours in which you develop and peer review a case study working over the course of 16 days. You can keep working while you do it, so you do not need to stop work. This is all online, so it has many benefits and a lot of flexibility, but also very tight deadlines. So I encourage you to go look at these, and I'm actually going to share the enrollment links. So this is now a one-click enrollment in order to join these. The experiences of children, caregivers, and helpers. So this is based on the peer knowledge. So this is based on the Insights report shared and what practitioners, 873 practitioners shared. And this is micro-learning. So if you only want to learn about to see what your colleagues from all over Europe and Ukraine came up with about supporting caregivers, you can just go do that module and earn certification for that module, or you can you can continue to do all 6. Now, coming up, of course, is a PFA Connect number 4. As we say, it's every other Wednesday. So the next one is the 12th of March, and I've shared the links for you to be able to request your invitation. So just to recap, we have now a recommended learning pathway for those who are starting out. We recommend the PFA Basics, the PFA Insights, which are these self-guided courses. You can look at the report, but you can also go for the courses, which will help you really make your way through and focus on the sections that you're interested in. PFA Connect every other Wednesday, and then the peer learning exercise where I just shared the next cohort dates. The last piece, which I won't go into today, is the Impact Accelerator. So we'll be inviting everyone who's participated so far and anyone else who'd like to join to actually think about a local project they can develop and implement. And as part of that, we'll be introducing a tool called PFA Measure, which is really about for any practitioner with or without mental health background or expertise to be able to gauge what has been the effectiveness of their peer learning intervention. I think I've almost managed to stick to time just to share with you for those with poor connectivity, but also those who are interested in content around global health and with some content focused on mental health and psychosocial support. You're welcome to register for to get the podcast, and then also to follow us on social media. So once again, thank you, and look forward to the discussion.
Thank you very much, Reda. So we have arrived to the Q&A session. So I would like I would like to ask all of our speakers to please turn on your cameras. And I see that you have already answered a lot of questions in writing. I see a question here. This is for Dan. Thank you, Dan. These are really interesting findings and really informative. I would love to learn what were the challenges of giving PFA to children. Did you give this training to conflict-affected kids from Ukraine or their peers who live in Europe, like in schools?
Oh, this is a good question. Thank you. Now we provide PFA for children in some regions of Ukraine for our teachers, for psychologists which work in schools, for our volunteers, for our staff which work with children. And we dream and think and wanna provide some our children, provide some our trainings online for peers in different countries. But now we provide a short introduction to PFA, a short introduction online. This is a 3-hour webinar, and now we have capacity to provide this only in this format, but our dream to provide this for Ukrainians in another countries. And in our MHPSS unit, we have a special PFA sector. And one of the tasks of this PFA sector is how to provide it to another countries. And I dream and I think that we do it in 2025. Yeah. Very briefly, sorry.
Thank you so much. We have another question. How can I get PFA certified? I think that this one is for Reda.
Okay, so we offer a range of options. As we said, if you have no PFA for children experience or that you're really just starting out, there is the e-learning module available on both the Child Hub and the TGLF platforms. And then we offer this progression, this learning pathway. Each one, you will earn a certificate that is very specific about what we are certifying. So it's really by combining certificates that you get to a meaningful competency, and then that we believe is best complemented by the technical trainings offered by the national societies and from other actors.
Thank you very much. As I see, we have another question in the chat. Please, you can write your questions in the Q&A section as well. So the question is, what is your experience with PFA and the misconception of needing to know a lot about mental health to diagnose? How do you help participants in your trainings to understand the importance of prevention and mitigation stress instead of providing therapy?
Dorothy, if you allow me, someone then want to compliment?
Of course, please.
I don't know if you remember that I present a pyramid in my presentation, okay? And this is true. We have many people that always say, no, this is a clinical approach. Can be that discussion. And we are in democracy, and this is welcome, okay? But in this pyramid, you can see that the most important is at the first level when more people need support, and it's when all of us, we can provide that support by training in PFA. And as I say, it's not something that just professionals can do it. It's all of us with the right skills, the training that, for example, Reda mentioned, Nicolina, and them. Yeah, and we are doing a huge campaign for our society to understand that everyone, like all of us, we have a training for sure in first aid. We need to be everyone training PFA as well, okay? I don't know if I'm answering. I don't know if someone wants to complement, but yeah, we are in these campaigns to make sensibilization that everyone can provide and not just professionals. And then when we detect that is needed, we refer to the professionals, okay? This is what I can say. Over.
Thank you very much. Gracie, I would also like to ask a question from you, if you allow me. So there are a lot of prejudice and taboo around the topic of mental health support. And how can you tackle that? How can you fight it when you see there are people who would need mental health support, but they would not allow you to help them because of all the taboo that is around the topic? Thank you.
Dorothy, this is a good question because, as we mentioned, this is a thing that we are many organizations and of course IFRC and all the movement working in transform our society to really combat stigma surrounding mental health, okay? And one beauty thing with PFA, you learn, but also you understand how to approach the cultural thing, no? And you respect the people, and we have another ways to address, and they are gonna be open at some moment based in their culture, and they are gonna reach to you. So for that reason, we organize some activities for children. Sometimes people say, but why Red Cross or Red Crescent is always organizing some kind of activities? No, it's with this meaning behind for the parents that maybe in their culture is a taboo, like you mentioned. Through this, maybe the history, the storytelling that is this day in this activity, make them to understand better the mental health. So in summary, it's one of our homework every day, the Red Cross and Red Crescent National Societies, to destigmatize mental health throughout many activities that we organize, because it's a deep work here that I invite everyone from now on to be a fighter as well and join us to combat stigma surrounding mental health.
Thank you very much. I see we have another question. How can we best provide psychological first aid to support children in times of crisis and help them feel safe and understood? Please feel free, any of you.
I don't know if Nicolina would like to compliment based on their experience, and because I don't want to feel that I am the only one speaking here.
Thank you, Gracie. So I hope you received some ideas based on all of our presentations. What are the available resources in front of the Red Cross? So Grace invited you kindly. You can reach out to the national societies of the Red Cross in your country or in your local branch. But there is also those beautiful online opportunities that Reda was presenting. So there is the platform. All the links will be shared with you. So there will be different opportunities depending, of course, if the course is currently available in your local language or not. For example, in the case of Croatia, we have, of course, the opportunity to join the online in English. But if there is anybody interested in the PFA for children in the Croatian language, so it's the Teachers Agency portal, or you can reach out directly to the Croatian Red Cross. So I would also just use the opportunity very quickly to complement to the previous questions on how can we make sure that people will not go into therapy. So I believe that it's also based from our experience, because this is something that the teachers ask in the beginning, because sometimes it seems that the boundaries are not so clear, but after the training and after you really go into the materials and PFA for children that we offer in those different modules online within the TGLF, the Go platform, and so on, it makes it very clear what are the principles on psychological first aid. And one of the three very important principles is the link principle. So if we have to put it very easy in just one sentence, whenever somebody is not feeling comfortable and think that they have not enough knowledge to proceed with whatever the identified needs are, then the safe referrals are the ones that are very important. This is why we have to collaborate with all the other available sources, local NGOs, health systems, whatever is in place in our context.
Thank you very much, Nicolina. Before we go on to the next question, I would just like to remind all of our dear participants that the recording of the webinar and all the slides are going to be uploaded on Child Hub, and we are going to notify you about it via email. So our next question is to whomever who would like to answer it. Hello, as a child protection project manager at the Belgian Red Cross, I train volunteers that are in first line with children in distress. Do you have any replicable modules, tools that I could use to train these volunteers so that they themselves can provide psychological support to the children involved in the project?
I think also Reda then can complement. I took the floor, but it's important that we are going to use here the link component of a PFA. We are going to link you there because in Belgium Red Cross already is having extraordinary resources ready that you can use. But over to you as well, Reda.
No, I was going to first, yes, refer to Red Cross colleagues to share the Red Cross resources. The complement I think that we're trying to add is really PFA is psychological first aid is really about making that human connection with children. And so connecting with other humans, including other humans who may know more than I know about Ukrainian children and interacting with them and supporting them, that's really the complement that we hope to offer to complement the technical trainings and to emphasize how important that can be in terms of helping a Belgian Red Cross volunteer, for example, really connect the dots, yes, make the link between the technical training and information they're receiving and actually how then they bring that on to, connect that with their emotions, with what they feel, as well as what they know. When we can bring those pieces together, then we have really something powerful. And because of displacement, there's a real relevance to connecting with others across borders, particularly with practitioners in the Ukraine, which is actually most of the participants in the peer learning activities so far.
Thank you very much. We are waiting for other questions as well, but before we wrap up, I would really like to share a very short info with you where you can give us just a bit of a feedback on the webinar. It's just, 4 questions. For our participants, thank you very much if you take the time to answer these questions. There is another question to Dan. Can someone perhaps then, who mentioned this previously, how can we support parents and caregivers who are possibly harming their children with their own stress? I find this part a bit hard to approach.
Oh, maybe I have some trouble with my internet connection. Please repeat your question. Sorry.
Yes, of course. How can we support parents and caregivers who are possibly harming their children with their own stress? I find this part a bit hard to approach.
All time we start with two components: community-based activities, including community-based PSS and trainings. This is the best way to support caregivers, and this is a support way to support the best way to support children. And we try to combine all this to approach. And I think that PFA is not only intervention. PFA is an end-to-end approach. This is a big baggage with many tools to provide care for those who that need. And I ask you start this from providing PFA for all, for parents, for caregivers, for teachers, etc., etc., etc. Different type of PFA for different categories, but just try to provide it, and not only for caregivers, and to start to provide it for your staff, for your organization, and this is a good first step to start your care about yourself and start to care about who this need. This very briefly. And if you need a more detailed answer, please send me this question to email, and I try to deep in this team. Yeah.
Thank you very much. Our next question is, how much do you build on the 5 key elements of safety, calm, self-efficacy, connection, hope in your PFA training? Who would like to answer it?
I can maybe very briefly. So thank you for asking. So the hopeful principles are incorporated in the PFA approach and also in the other approaches that we use within the movement in the lovely pyramid that Gracie already showed. So they are very important in our work. And depending, of course, how long the training is and who are the participants and how in detail we will approach the principles, but actually the PFA principles of look, listen, link are based on the hopeful principles that are mentioned in the question. So maybe Gracie or somebody else, if you would like to add something on it.
No, I think you brilliantly mentioned, but yeah, this is really, maybe if you can repeat the question, because I want to connect something that will be good. Okay, Dorothy, sorry.
I'm sorry?
Yeah, let me find again the question, because I was having something in mind to complement.
Yes, I see. I will read it to you. How much do you build on the 5 key elements of safety, calm, self-efficacy, connection, hope in your PFA training?
No, I think already Nicolina said that this is the base also of the training. No, so this is a part that is there.
Thank you very much. We are coming to the end of our webinar, and as I see, there are no more questions. So I really would like to thank all of our participants to be here today with us. It's really amazing. We are really happy that so many of you came. We are really grateful. And I would thank all of our speakers today who were so amazing. And thank you very much for participating and taking the time to be with us here today. So I wish you all a really nice afternoon and day. I'm sorry? Okay. Sorry, I thought just some of you just wanted to say something. So thank you very much for being here with us, and have a nice afternoon, everyone. Goodbye.